Greetings, my very dear friends. I'm Professor Edin Dibuago, a professor of public health medicine. We're still talking about prostate cancer. And this episode, we are going to be talking about the effects on sexuality and fertility. We'll also talk about the myths and misconceptions people have about prostate cancer that ultimately lead to their having problems. So the effects on sex and sexuality. Prostate cancer, remember, some of the symptoms are sexual symptoms, erectile dysfunction, painful ejaculating blood and all that. So you'll find out that the effect on sexuality is there, but it's treatable. In fact, people who have prostate cancer, psychologically, you find out that they don't even feel like having sex or having anything to do because they're not in the right state of mind. For people who are young and they still want to have children, it also affects their fertility. It affects their fertility in the sense that even the medicine, the medication you take, they all affect your production of semen and all that. So the effect on sexuality and fertility is there, but it can be managed because the drugs you take effectively affects the prostate, which produces semen that is necessary for production, sperm you use. So because it does that, it reduces the production and it affects it. But when you do surgery, prostate cancer surgery, it's advocated that you do, there's what they call nerve-sparing surgery. This nerve-sparing surgery tries to limit the effect on damaging the nerve, the erectile nerve. This erectile nerve is just on the prostate. It is in close contact with the prostate. So it's difficult to remove the prostate without, harming it. But the nerve-sparing surgery tries to spare the nerve and reduce the damage as much as possible. So that recovery to full sexual function is faster. If it is in a very good hand, you find out that in 2 years, the sexual activity is returning to normal. So it's good news. Once you do the robotic radical prostatectomy and you follow it up with some exercises, there are things they use to make you return to active sexuality fast. There's what they call vacuum pump. They use it in combination with some drugs that aid you to recover. Within 2 years, many people who did that operation recovered their full sexual activity. But even before that, in 3 months, they use vacuum pump, they use those drugs, they make love beautifully. There's no problem. But the only thing is that producing sperm is impaired because those semen, the liquid that is in sperm, that helps transporting sperm into the female genital tract where fertilization occurs is not there. So what people do, especially in advanced country, is to bank semen if they still want to have children. Even in those advanced countries, if they don't bank semen, they take a direct specimen. They harvest it from the testicles. That is about sexuality and fertility. It's a problem, but it can be handled. I think it's good we stay alive. Then the sexuality problem is something that can be managed. It improves with years after the surgery. Most people, 2 years, they're active. They don't use the vacuum pump again. They don't need drugs. That is it. This leads on to the other thing about the myths and misconceptions people have about prostate cancer. So many of these things. People say so many things that make them expose themselves to danger. First, they think it only occurs in families. That it only occurs. It's not true. Prostate cancer can occur. Somebody can be the first person in the family that will have prostate cancer. Always keep that in mind. Don't say you won't go for screening because it's not in my family. It doesn't occur. My dad didn't have it, my granddad didn't know. There's always somebody who has to be first. So it's a misconception. We need to discard it. Though some other people think it only occurs in old men. It's not true again. We agree that it's common and the prevalence is more between people who are 60 to 70 years, yes. But it can even occur in people who are 40 years. I've seen that. It can occur in people who are 75 years. So those are myths. Another myth is that some think it's sexually transmitted. It's not true. Prostate cancer is non-communicable disease is not sexually transmitted. Some ladies will start running away from their spouses because they think they have a prostate cancer and they will infect them. No. That is the time he needs your support. Ladies, he needs your support. It's not infectious. If you can manage psychologically to have an erection, you need to have your full sex. It's not a problem, Again, people think that when you're doing such, people refuse to take biopsy. They think taking biopsy, we spread the cancer. It's not true. Biopsy, and in these days, is very beautifully done technologically. It's ultrasound guided. They just aim at suspicious places and take few bites and send to lab. So it doesn't spread it. So because if you're there saying you won't take biopsy, I've seen people say it. They are scared of even biopsy, that once you do that, and our spiritual so-called God of men don't help matters. So many of them tell you that once you let them touch you, you're dead. It's not true. These are misconceptions. We're killing ourselves. Some even think that if eventually you arrive for like robotic radical prostatectomy, but once you do it, your days are numbered. That it's better to leave it. Yeah, this is not correct. You leave it, you die. Especially if it is a very aggressive type. Please, my people, don't listen to those misconceptions. Don't at all. Some even think that having sex, some try to reduce their frequency of sex and say, if you have sex, you will get prostate cancer. It's not true. It's not true. It has nothing to do with that. Funny enough, on the other extreme, some people tell you that if you have sex 21 times, if you ejaculate 21 times in a month, that you will never, that's how they put it. And these things are all over the social media. You will never have a prostate cancer. Incidentally, we looked at it and we found out that there was a study in 2016 among 32,000 men. And this study found out that really people, however, the methodology is not very clear, but that people who ejaculated 21 times in a month had 20%, just 20% less chance of having prostate cancer when compared to people who ejaculated 4 to 7 times. So 20% less chance. What of 80%? So really you find out that you can't bank on it. I say because you have so many girlfriends, you have so many concubines, and you kill yourself when trying to ejaculate 21 times in a month that you won't have cancer. It's not true. Incidentally, just a year after that study, in 2006, another study came out, maybe better methodology, and said that no, this is not true. It's not correlating. But you'll find people all over the social media just telling you once, and people you must have too much sex to avoid prostate cancer. Big lie. Please, screen. And some people think that they must wait before they see symptoms, prostate cancer symptoms, before they raise alarm. And we said in one of our videos that once you start having symptoms, it's bad. Prostate cancer most times does not show the symptoms until it is bad. That's why it's recommended that you screen. PSA screening, so important. Or you occasionally can go to your urologist, do rectal examination and all that. But PSA is quite okay, it's affordable. And also people think that all prostate cancers, I've had it, that is slow growing, it doesn't kill. Like when we talked about treatment, we said in some you do active surveillance, you do watchful waiting, but not all. Many of them are so aggressive. I buried a very dear friend. I lost a very dear friend. Last week, we did the burial because he had this within 8 months of the symptoms showing. He died. He was so aggressive. So you don't wait for symptoms. It's not always symptomatic. Some very aggressive ones, once the symptoms come, it's bad news. So my dear friends, prostate cancer, please, let's all fight it. It's something we can stop. We can stay alive. We, Community Positive Health Attitude Initiative, we plead with you because we love you. Your family too, they love you so much. You have friends. You have people that are so fond of you. Please stay and stay with them. Stay. You still have so many things you can do for humanity. Stay. Prevent some of these preventable problems. Prostate cancer, prevent it by going for screening. Go for screening today. It's good. Do not say, many people say, no, it can't happen to me. Why me? It's not my portion. Whose portion is it? My dear, it can be anybody's portion. Please, go and get screened for prostate cancer. Thank you so much, and may God bless you.